We're joined by Dr. John Hammer, an infectious disease expert at Rose Medical Center. Thanks so much for coming in this morning.
Well, thanks for having me.
We have several questions, and we won't have time to answer them all, but let's start with the social distancing. That has become a word now and a phrase that everyone's used to. Why is that so important?
So in the setting of an epidemic, especially one that is transmitted easily from person to person, social distancing is huge in terms of giving us the ability to slow down the epidemic, and in essence to prevent a surge of infections that can potentially overwhelm a hospital system.
We talk about that flattening the curve.
Exactly.
However, a lot of people out there and a lot of viewers watching are going, if I'm going to get it anyway, why shouldn't I just get it over with? Are you expecting that most Americans, a majority, will see or somehow be infected with this at some point?
Actually, probably yes, but the question is when. And again, that's the usually important part of this, is what we've seen in other countries, what we've seen in other cities. Take Seattle, for example. We see a large number of people coming into the hospital system with the potential to actually overwhelm the system. And that is what we want to avoid.
Yeah, we have to protect people like you, doctors and our caretakers.
Well, there's that, but there's also protecting the elderly, protecting vulnerable populations who already have chronic illness. Those are the people that tend to get very sick and potentially die from this infection.
So we know that you, along with many other medical experts, are learning from other countries, and we're learning about carriers, particularly people who are not having symptoms. Mm-hmm. Tell me more about that.
Yeah, well, certainly people either asymptomatic or more commonly pre-symptomatic, meaning that maybe in the hours to a day before you get sick, you might start to shed virus. That probably does happen, but we don't think it's the major driver for the epidemics. We think most of the transmission happens after a person becomes symptomatic.
I had a viewer who posted on my Facebook page this morning, do I need to worry about going through a drive-through if I am ordering food from the grocery store or ordering carry-out? Do I have to worry about the virus coming in with those things?
Yeah, great question. You know, we know that this virus is primarily transmitted by, the medical term is fomites, but it basically is things that we touch, and then we touch our face after touching a thing that is contaminated with the virus. We know that the virus can live on surfaces for anywhere from, depending on the surface, from a day to 2 to 3 days. So there is some concern about packaging, et cetera, and that kind of goes back to hand hygiene, which is really the cornerstone in trying to stop yourself from getting sick, but stop the spread of the disease. And that can be done either with washing hands for 20 seconds with soap and water, or using an alcohol hand gel that is more convenient in most cases.
This was from a viewer as well. If you order food from a restaurant, say they're delivering it, say you're doing DoorDash or something, does putting it in the microwave kill the virus? I'm putting you on the spot, but is that something, are those things that we should worry about?
You know, heating a food item will help to kill the virus, yes. I'm more worried about the packaging and handling that. In other words, you're not going to be able to decontaminate the box or the bag that something comes in. But again, after you unpack the food and serve it or get it out of the packaging, wash hands for 20 seconds before you eat.
They like to eat pretzels or they're eating apples or something like that. Is it better to use a utensil instead of using your hands to eat anything?
If you wash your hands before you eat the item, you should be okay.
Okay, let's talk quickly about a vaccine. We hear and we're seeing a lot about a vaccine being in the future, but that it might be some time. What's your take on that?
I think that it'll be in the future and it might take some time. I
think it'll be a year plus?
It could be as long, but most likely will be as long as a year. Maybe we'll get it in a little bit less than a year, but it takes time. You have to remember, we have to do clinical trials in animals first, then we do early trials in humans to see if it works, to look at its safety. The important thing about a vaccine is we have to balance its effect. We have to see that it actually works and produces and stimulates the body to produce what it's supposed to protect the body, but also that it's safe. We go back to the swine flu vaccine in the 1970s. It was not well received and was a problem. We don't want to do that again. We want to have a vaccine that is safe and works. Again, though, the bulk of this epidemic will come and go likely before we have a vaccine. So we have to look at these other mechanisms of protecting ourselves and protecting our hospital systems from being overwhelmed.
Dr. Hammer, thank you so much for coming in this morning. We know how busy you are and we appreciate your time.
Hey, it's my pleasure.